Instructor Sam, and I'm going to be covering everything that you guys need to know about the EKG. EKGs are so important. Why are EKGs so important? Because basically what it does is it gives the doctor a picture of basically what's going on with the patient's heart. Something that we call arrhythmias. When someone has issues within the heart, we call it arrhythmias. But we're going to cover so much in this course, all right? So it doesn't matter if you're becoming a medical assistant or you're a patient care technician or you're a nurse or so forth, right? It's extremely important. You need to know what EKG is, all right? You don't want to be just one of those people who just work in a hospital and you're actually caring for a patient and you have no idea what's going on that EKG machine screen. So it's extremely important for you guys to know. And majority of our students does a wonderful job on the nationals once they pass the course with the Emergency Training Center. I'm so proud of you guys who made the decision to basically join our course. So let's get ready to cover everything regarding EKG. I'm going to cover the basic information that you guys need to know about EKG. The speed of an EKG machine is 25 millimeters per second. The EKG machine records up to 12 leads simultaneously and 3 leads as well. We'll talk more in detail about this. It records the information into the patient EMR, also known as electronic medical record, and we'll cover that when we talk about medical terminology and medical terms and abbreviations. 4. The electrocardiograph paper is heat and pressure sensitive, which means that either heat or pressure can cause a mark to appear on the paper. The electrodes and the leads, we'll talk more in details about them. You need to make sure that you have a razor and alcohol wipes. Well, the razor is useful. Why? Because if the person has a lot of hair on them, you want to be able to shave the hair off the patient's chest. Not all of the hair off the patient's chest, just the area that you need to use. The alcohol wipe is good to use when someone has lotion on their skin, maybe they're sweating or they have oil, because it'll be very hard for the sticky electrodes to actually stick. They'll just slide off, all right? So it's very important as well to ask the patient if they need to use the bathroom, all right? Because the patient is going to be lying down for a certain amount of time, right? So you want them to be as comfortable as possible before you start your EKG. ECG is the same thing as EKG, so don't ever be confused. In certain part of the world, some places they use ECGs, and other locations they use EKGs. But in the end of the day, they mean exactly the same. Another thing as well, if you're applying for a job and you see ECG technician or EKG technician, it's exactly the same thing. The patient needs to be positioned supine when you're doing the EKG. So supine basically means the patient is lying on their back, looking at you. All right, so the legs can't be up during the EKG. So when you guys come into practice doing your skills, if you're practicing on someone else, you're going to ask them to lie down flat, supine. This patient is prone, all right? So a patient who is face down, right, on the bed, right, you don't perform EKGs. No ECG on a prone patient. We call that prone, all right? So when a patient is on their face, it's called prone. So guys, we want to talk about the 12-lead EKG placement, all right? 12-lead EKG placement. So I want you to pay attention and really look at what's happening here, right? So there's already a lecture already created for you guys to watch on how to actually perform the skills. Well, I'm going to really talk very briefly about what's happening here. All right, so all these black dots right here are basically what we call the electrodes, right? The circle black dots are called the electrodes, all right? So the electrodes are connected to leads, so make sure you watch the video that we created for you guys. Electrodes are connected to the leads, so it goes directly to the machine once the patient is fully connected. So if you see here, RA, so look for the RA. What does that stand for? RA, and make sure you take a note of it because it's going to be in your exam, stands for right arm. RA, the letter R and A stands for right arm. Let's look at LA. Guess what does that stand for? It stands for the left arm. Left arm. So let's talk about RL. RL. So what does the RL stands for? Right leg. RL stands for right leg. Let's talk about the LL. What does the L stands for? Left leg. LL stands for left leg. All right, so let's talk about V1, V2, V3, V4, V5, V6, right? It goes on the patient's chest. Just know this right now, sometimes our students get confused when they perform in the EKG, especially when they come the first time. V1 is not on the left chest, it's on the right side of the chest. V1 is on the right side of the patient, right? So talking about the anatomical position, we're talking about this V1 is on the right side of the patient. V2 to V6 is on the left side of the patient. All right, just like how you see left arm, which stands for LA, and then you see LL, which stands for left leg. All right, so V1 is on the right side of the patient. 3-lead placement. All right, so 3-lead placement. All right, so the 3-lead placement is actually used for when the patient is coming into the hospital or they're already in the hospital. Maybe they're staying for 3 to 4, 5 or 6 or 7 days, all right? So RA stands for right arm, LA stands for left arm, and the red is going to stand for left leg. So as you can see, so this is a way for you to actually remember how to perform the EKG or actually connect the patient to what we call the monitor. They're going to ask you to basically connect the patient to the monitor. All right. So some of them are not even labeled, right? If you work in the hospital and people are basically just going off the colors. All right. So think of red as fire. Fire. Red stands for fire. Fire. Right. So then the black stands for the smoke. So above the fire, you have smoke. The red is going to be on the bottom. It stands as fire. And the black starts, and the black stands for smoke. Extremely important to know. So let's talk about electrodes. As you can see here, there's different manufacturers. They look different, all right? So electrodes are the sticky things that you actually place on the patient's chest. The electrodes, all right? Electrodes used for 3 leads EKGs, right? Or the electrodes used for 12 lead EKGs, all right? So it's extremely important for you to make sure that you know the electrodes are used to be placed onto the patient, all right, the sticky parts. So let's talk about rhythms. Why rhythms are so important? Well, rhythms are extremely important because it helps the doctors and the nurses and the technicians who are working with the patient or someone who's just watching the patient, right? It's extremely important. Rhythms are extremely important because this is how we could determine if something is going on with the patient. So let's talk about the first topic. Arrhythmias, right? So arrhythmias, abnormalities in the cardiac rhythm are called arrhythmias, right? If there's something that's wrong with the person's heart, right? It could be determined by looking at the EKG, right? These can result from disturbance anywhere along the electrical conduction pathways in the heart from the SA node through the right and left bundle branches. The best way to determine whether an arrhythmia is present is to know what the NSR looks like. All right, extremely important. All right, so there's PowerPoint slides for EKGs, there's a lecture for EKG, there's this one as well. So many information that is being provided to you guys that you guys could utilize to be able to pass your EKG exams. We're working hard to make sure the students have everything they need. NSR, what does the NSR stand for? Well, the NSR stands for the normal sinus rhythm. How do you read this, all right? So a lot of times students start to get confused. No worries, I'm gonna help you. So let's talk about the P wave, all right? So the P wave is extremely important. So as you can see, I have different samples for you guys here on this ECG. So let's start off with the first one, the one with the green graph, right? So as you can see, the red little part right there, the little hump, that's what we call the P wave. All right, so as you can see on the second sample right here, where it says sinus rhythm, a P wave present on the sinus rhythm, so it's extremely important. There you go. There's another P wave. So that first little bump that you see before the really sharp point, that is the P wave. So it's extremely important for you to know the difference. All right. So as you can see, P wave present, and then if you see where it says atrial fibrillation on the bottle graph, so here follow me. So the bottom one, right, the bottle graph right here, as you can see, the P wave is missing. But if you look at the second graph, right, going above where it says P wave is absent, you can see P wave is present. So that little bump right there is the P wave. Let's go all the way back to the first graph, which is all the way in the top. As you can see, that's the P wave, the one that's marked in red. That is the P wave, all right? So let's talk about all the other waves that you guys need to know about. Q wave. So Q wave is the one that's covered in orange, as you can see, the little sharp point that's going down. So you see the P wave, right, originally. So the P wave is marked green on this, right? Then you have the Q wave. So the Q wave is right here, the part that's marked orange. All right, so it's extremely important to know what the waves are. So P wave, as you can see in the next graph, right? The one that where the letters are different colors, right? So it starts off with the P wave, which is the first hump. Q wave, which is right there, that sharp point on the bottom. All right, so next we'll talk about the R wave. All right, so it's extremely important. So right now we know what the P wave is, Q wave is, then we'll talk about the R wave. So R wave is the pointy part. It looks like a cone that's upside down, like an ice cream cone, right? So that is the R wave. So that pointy part up there, right there, is what you call the R wave. All right, the pointy part is considered the R wave, all right? So as you can see here in this first graph, right, where it's covered in this type of bar, this red color bar, right, that is the R wave. So the pointy part of the upside down ice cream cone is the R wave, all right? So the pointy part is the R wave. So we know where the P wave is, right? So let's go back to the first graph. All right, so the first graph, you can see the P wave, then you see the Q wave, which is the pointy part going down, and then the longest part going up is the R wave. All right, so it's extremely important for you guys to know how to start reading this. If you like to, try to practice drawing it. Send a picture to me or whatever the case is, so at least I can look at it. So at least you want to make sure that you know the difference, especially if you're going to be the EKG technician. All right, so then let's talk about the S wave. The S wave is basically when the little sharp part is going down to the bottom. So after it reached the R wave, then you have the S wave. All right, it comes up a little bit, and then that creates the T wave. So the T wave is the little hump right there. As you can see, it's the little hump, right? It looks like an upside down U, right? So let's start from the beginning. You have the P, Q, R, and S and T wave, right? So it's extremely important. So the P wave is first, the Q wave is second, the R wave is third, the S wave is fourth, and the fifth wave is T wave. So it's extremely important to know where the T wave is at. Sometimes you might see a U wave. That U wave could be caused by bradycardia, which you guys should all know right now from bradycardia, or low potassium in the blood. Let's talk about the QRS complex. The QRS complex is basically saying the Q, R, and S is together, right? So QRS is a complex. Q wave, right? So it starts with the Q, R, and S, which is known as the QRS complex. Extremely important if you're taking an EKG exam. It's extremely important for you guys to know what the QRS complex is. It's basically saying the Q, R, and S together, right? without the T or without the P, right? So it's extremely important for you guys to remember this. So let's talk about SVT. Why is SVT extremely important? SVT is a heart rate above 150, right? The heart is moving extremely fast, right? From at least 150 to 250 beats per minute. That's extremely high, especially if someone's in a resting state. All right. So if you have someone who's in a resting state, they can actually pass out. So it's extremely important to make sure that if we have a patient in SVT, we know how it looks like. So everything comes much closer together, like the P, the Q, the R, the S, the T wave. Everything is a little bit much closer, right? It's not like the NSR, which is the normal sinus rhythm, where everything is really spaced out. It becomes harder to read the faster the heart is beating. All right, so let's talk about STEMI and why STEMI is so important. STEMI, the most deadly types of heart attack is the ST elevation, right? So the ST elevation is basically when you see the P, the Q, the R, the S and T elevation. So what's going to happen, you'll see the S and T is up. So it's totally different. ST elevation is extremely important, right? It means someone's having a heart attack, all right? The most deadly types of heart attacks is the ST elevation. What causes the heart attack? Well, blockage in the arteries, right? The coronary arteries causes the blockage. All right, so let's talk about the STEMI. All right, so what is the STEMI? Same thing, ST elevation, known as the heart attack, also known as myocardial infarction. All right, so when someone says the patient is having an MI, they're talking about the myocardial infarction. The person is actually having a heart attack. All right, so let's talk about bradycardia. All right, so bradycardia is basically when the patient's heart is moving extremely slow. We're talking about less than 50 beats per minute. The bradycardia is 50 beats per minute and less, all right? So this is basically what we call bradycardia, where the heart is moving extremely slow. Bradycardia, 50 beats per minute or below. All right, that's when it becomes a little bit dangerous, all right? But the actual numbers is really below 60. But usually when it gets below 50, that's when it becomes a dangerous state, all right? So extremely important. Let's talk about sinus tachycardia. Sinus tachycardia means that the person has a heart rate over 100. Is it dangerous that the heart rate is at least 110, 107, or 118? Not really. You could just been running or whatever the case is. When I go running, my heart rate could go up to 180 beats per minute, which will put me at SVT. But at a resting state is dangerous because it's like what's happening with the person's heart. Why is this person in a resting state and just sitting in a chair and the heart rate is above 100 beats per minute? All right, so it's extremely important to know the difference. A heart rate from 100 to 149 beats per minute is sinus tachycardia. Asystole. Asystole is where there is no heart rate at all, right? So when you see asystole, the person is dead, all right? So remember this, asystole patient, the patient is dead. There is no rhythm at all. I'm pretty sure you see these in the movies. When you look at the screen and you see that flat line, that person is dead, right? Or one of the leads are off. Pacemaker. So let's talk about the pacemaker. The pacemaker is a device that's installed into the patient, all right? It's installed into the patient to regulate the heartbeat, all right? So if the heart is beating too slow, the pacemaker is going to shock the person's heart. If the heart is moving too fast, the pacemaker is going to shock the patient's heart. The doctor put in the settings, they install it into the patient. What does your heart naturally does? It pumps blood throughout the body. All right, so your pacemaker pumps blood throughout your body. So if your heart is pumping slow, the person is not getting this rich oxygen that is supposed to be flowing through the person's body. All right. So what happens is the person starts to become weak and tired and pass out. All right. So that's why it's extremely important, if your heart is moving slow, that you get shocked. Boom, the patient gets shocked, and then it starts moving faster. That's what the pacemaker is for. If the patient's heart is moving too fast, what starts to happen is, well, you're still not getting enough oxygen, right? Patient could go into what we call hypoxia, right? A decrease of oxygen levels, all right? Hypoxia, all right? So let's talk a little bit more about the pacemaker, all right? So you're an EKG technician, right? Pacemaker spikes. This is how it looks like. You're not going to see your normal PQRST. Once the patient has the pacemaker installed in their body, you're going to see these pacemaker spikes. Extremely important for you guys to know that. All right, this is not ST elevations. This is a pacemaker. The patient has a pacemaker. You could tell if a patient has a pacemaker majority of the time because you'll see a little lump under the person's skin above the heart, right? So it's extremely important. It's in front of the collarbone. It could be either the right side or it could be the left side. Back in the days, they used to do the right side. Now, a lot of new surgeons are doing the left side. All right, so you might be able to see the pacemaker. It's a little round device implanted into the skin, all right, attached to the heart. All right, so let's talk about shockable rhythms. All right, shockable rhythms. Ventricular fibrillation. Shockable rhythms, all right? Disorganized heart rate, right? Extremely disorganized, right? Can't come up with a picture. VFib. It's a shockable rhythm. The doctor might say the patient's in VFib. It's a shockable rhythm, all right? So PVTs, pulseless ventricular tachycardia, right? The patient has no pulse, but you see a rhythm on the screen. Is it a normal rhythm? No, all right? This means that the patient is attached to the leads and electrodes and they're connected to the monitor. There's some type of rhythm that's happening, all right? This is a disorganized rhythm. The patient has no pulse at all. Pulseless ventricular tachycardia. This is a shockable rhythm. If you take your nationals for ECG, it's extremely important for you guys to know what a shockable rhythm is. It's VFib and PVTs. So let's talk about cardioversion. What does it mean to cardioverse the patient? All right. So this is more advanced training. That's why our EKG training is so good. They go into things that regular EKG technicians don't know. Usually what we call advanced nurses and doctors, we have to know this stuff. So cardioversion basically means a patient's heart, which is moving extremely fast. And what they're going to do is they're going to shock the patient while the patient is still alive. They're going to give the patient what we call a cardioversion. So the patient who is in SVT, right? Remember SVT from earlier? If you don't remember, please go back to it and research what it means. SVT, supraventricular tachycardia, with a heart rate of 150 or more. The person's becoming confused and tired, really weak, having anxiety. The patient is really becoming unconscious. So what do we want to do? If the heart rate is moving extremely fast, just like the pacemaker, right? This person's alive, but they don't have a pacemaker installed in there. So the cardioversion will actually slow down the person's heart rate. Boom, the patient's heart rate starts to slow down. All right, so that's a cardioversion. All right, so TCP. What is a TCP? A TCP is a transcutaneous pacing. TCP is a transcutaneous pacing. All right, which means that the patient's heart is moving slow. The patient is still alive. So they're going to shock the patient, and that's what they call transcutaneous pacing. They place the pads on the person's chest they shock the person back into a normal cardiac rhythm. What is the slow heart rate? What do we call it? Bradycardia, right? So it's extremely important for you guys to know what bradycardia is. The heart rate is moving extremely slow. Maybe the patient is below 50, going into 40, and getting very close to 30, and then almost at 20. What happens when your heart beat extremely slow? It's eventually going to stop. So that's what the pacemaker does as well. It shocks the person's heart. Boom! The person's heart gets shocked and then goes back to 70 to 80 beats per minute. BPMs, beats per minute, all right? So let's talk about artifacts, all right? So artifacts, what is artifacts? Well, artifacts can be caused by a number of reasons, right? The patient could be moving around. The person might have an electronic device on them, which interferes with the ECGs, and the ECG looks not normal, everything but normal, right? Interference. Maybe the female has metal on her bra, right? Interference, right? So there's different ways. Or maybe her chest is too tight because her bra is too tight, right? Interference. Electronic devices like these Apple Watches, right? And you have a cell phone on you, which could interfere with the rhythms, right? Interference, all right? Which is causing artifacts, all right? So let's talk about wandering baselines, all right? So wandering baseline basically means the patient is moving around a lot. Your ECG is going from up to down, all over, up and down. It looks like a wave of an ocean. That's basically what you call wandering baseline, all right? A wandering baseline is basically when you have the lines going up and down and up and down and up and down, and that is a wandering baseline, all right? So you want to, or if the patient's shaking, if the patient's cold, which could cause the patient to shake. So what are you going to tell the patient? Get the patient a blanket. Turn off the lights if you can, all right? Get the patient to be comfortable. So these wandering baselines will go away. Always let the patient know this is a harmless procedure. They're not going to get hurt. An EKG is not going to hurt you. All right, so it's extremely important to let the patient know this is a harmless procedure. So if you see wandering baselines, you can ask them, it's okay to calm down. All right.